So will Ontario try to stop its surging COVID cases with a new curfew like in Quebec? We're hearing probably not. Will they impose new emergency measures? Look, deaths in that province topped 5,000. And tomorrow there are new modeling numbers expected to come out that will show ICUs could be overwhelmed. How bad could it get, and what measures should you expect to see? CTV News Queen's Park Bureau Chief Colin D'Mello joins us with the latest. What a day at Queen's Park, Colin. Let's start with the worsening situation. What are you expecting to see from these modeling numbers Premier Doug Ford called, quote, scary?
Yeah, well, I've actually taken a look at some of this data, and it shows that, if nothing changes between now and February, we're going to see at least 6,000 cases per day every single day. And of course, there's that trickle-down effect from, new cases. There is a lag in terms of hospitalizations, but you will see hospitalizations. You will see increased usage of the ICU, and of course, deaths will follow as well. So I think this is a worsening situation. The other thing, Evan, is there is a lot of concern about that UK variant, really going crazy in Ontario. Currently, there are just 6 cases of the UK variant, but some of the information that this cabinet has seen is this. If that UK variant really starts to spiral out of control, if there's community spread in Ontario, it's much more infectious than the regular strain of COVID-19, then it would take just 10 days for cases to double. And I think that is what is truly driving a lot of fear in this province. Right. They're trying to kind of head off that UK variant.
Well, and we've seen the cases in the UK. They're experiencing that very thing from that variant of the virus. There's then talk about a potential curfew. Now we're hearing maybe not, like Quebec has in Ontario. But what other measures are you hearing could be imposed by Doug Ford tomorrow in that province?
Yeah, the curfew was certainly under serious consideration, but they just decided that the impact was actually going to be too low compared to, the effect it would have on people's lives. But one of the things the Premier is seriously considering tonight is redeclaring a state of emergency in this province. And that pretty much gives his cabinet, the power to unilaterally close businesses, impose new restrictions, close things like daycares if they choose to. Now, we're not expecting them to go that far, but they are looking to go beyond the current lockdown that's, imposed right across the province of Ontario that was brought into effect on December 26th. So we're going to see where they're going to go from here. But our sense for now is that they're really looking at workplace outbreaks, things like manufacturing, things like construction, etc. Because as the Associate Medical Officer of Health says, they're still seeing workplace outbreaks related to these sectors. People who carpool into work, people who are taking, smoke breaks, coffee breaks together. They're not wearing their masks. And that's how the infection is spreading. The other thing they're looking to target is people, right? They have so many tools, and I think they've exhausted all of their economic tools. Now they're looking at people. How do they get people to stop meeting up with one another and to stop spreading the virus as they go from household to another? The Associate Medical Officer of Health shared a startling number today. About a third of Ontarians say they're no longer following the public health restrictions. They are going and seeing people and welcoming people into their household. So that is another thing that they're looking to crack down on. The question is, how do you do that? And what measures do you bring in to really control people?
And we'll be finding out what emergency measures, maybe another state of emergency in Ontario tomorrow. Colin D'Mello in Queen's Park in Ontario. Great to have you back on the program.